my own studying based on the nursing process. Now, in the nursing process, this is really how we go about making decisions, right? It's our framework for decision making and how we come up and implement a plan of care, hoping for our best possible outcomes. Frankly, it's the same process that we can use as a study process or study framework to find key information that's really kind of the heart of the content of what we need to master in nursing. So when I do this one-on-one with students, I tend to just start at the top from the nursing process, and I generally ask them to fill in what these categories are. But since we're as a group, I'm going to save you that trouble today and just add them in. So again, we all know that these are the steps of the nursing process. In that assessment phase, we're gathering up information about a patient's medical history, their social history, their physical exam findings. Sometimes we're looking at data like lab values, that type of thing. That's our assessment phase. In the diagnosis phase, and I'm going to put my little pointer on here, it might be helpful, I'm not sure. But in that phase, we have diagnosis. That's where we're really concentrating on what is our primary problem, what's our priority problem that we're going to be addressing. And then in the planning phase, we're looking at those goals and outcomes, right? Along with our patient, we're making priorities of what we're going to implement as far as our nursing care goes. And then in implementation, or sometimes some people call this interventions, right? This is where we're applying our nursing care. And then in our evaluation phase, we're going back to measuring if what we did was effective. So let me show you what I mean by this in studying, how we can use this in a study process. So right now, what I want you to do is think about when you've seen nursing test questions throughout your career here as a student. Do you see a lot of questions focused on what the nursing assessment is? I would say in my history as a nursing student, and even in taking NCLEX, you're going to see a lot of test questions based on the nursing assessment. Would you agree?
Yes.
Yeah.
Yeah. Okay. So you're going to see a big bulk of questions come out of the nursing assessment. Now, diagnosis, think about tests you've taken. You're probably not going to see a lot of specific questions on the nursing diagnosis. The nursing diagnosis NANDA terms are actually trademarked. They're not used on NCLEX. Okay, we do see things about a priority problem, prioritizing, but we don't see a lot of questions specifically worded with the nursing diagnosis. So I would say that's an area you don't see as many test questions on. Now, what about planning? Do you see many test questions? And since you two are in that conference room, I'll just let you shout out. Do you see many questions on planning?
Yeah.
Yeah, somewhat.
Would you say I think it's true, you will see a few, but do you think there's more about assessment or more about planning?
Way more about assessment.
Okay, so yes, I would agree with you there. And then what about this implementation phase? And I like to also call it interventions because, it's all the things that we're going to do within our scope of care, within our scope of practice. So do you see very many questions about nursing interventions?
Mm.
Yeah. Yep.
Yes, you will. You'll see a lot of questions. Now, on this evaluation, I'm going to challenge you a little bit to think about this. If you can assess, you can evaluate. Because in the last stage, we're looking at if what we did was effective, if we got the result we wanted. So instead of thinking about this E as evaluation, because if you know the assessments, you can evaluate, I want you to think about this E as education. So you will see a lot of questions because part of our scope of nursing is so much guided towards that educating of the patient, right? I mean, that's a big part of what we do too, besides rendering care. So in summary, what I want you to think about when you're going forward with studying, when you're working with students, when you're gathering up information, these are really the key areas of content that students need to focus on. And, you know, early on, sometimes it's easier for people to sort of categorize things. There's so much information, right? How do we sort out what's really important? So I found that students really do understand these categories. If we study and concentrate on our assessments, what our interventions or implementation is, and what we're teaching our patient, that's about 75% of test questions right there. So if you have a good command of that kind of material, you can pass a test. Now, that's not all of it, but in trying to narrow down what's the heart of the matter, I find that students react really well to understanding how to get that information together to start knowing what to study.
Mhm.
Okay, so again, these are kind of those key categories: assessments, implementation, patient education. Now I've put priority problem here for a reason, because if you think about the learning process, you know, we have to be able to walk before we can run. So this doesn't answer everything. And why doesn't it? Well, it's because that priority problem, we're really prioritizing at every step in the nursing process, right? So at every step, like in our assessment piece, if I'm looking for what assessments I'm going to do, if my patient has problem, let's say with their airway, I'm prioritizing those assessments associated with airway way over, you know, assessing their skin, right? If I'm worried about their airway, I'm not worried about their fall risk yet. I need to take care of them right here, right now. So this is why I say, as you mature, as critical thinking develops, you realize we're kind of prioritizing in every stage of that. And whether it be that we're prioritizing with Maslow's hierarchy of needs, right? Physical needs on the bottom, then safety and security, love and belonging. If we don't have our first physiological needs taken care of, we can't address anything higher up the chain, right? So that's a priority framework. Or like ABCs, airway, breathing, circulation. I mean, those are very common prioritizing frameworks that we see. So I just wanted to kind of point that out for you to think about in your own study. Those categories of assessments, interventions, patient ed gets a lot of it, but then our thinking process does mature with this priority framework. So here is where I think students, and I struggled with this as a nursing student, and I've seen it with other students. The hang up that a lot of us tend to get is in nursing, we call a lot of the same things different terms. We like to have a different term. So this is confusing because we'll see those assessments, interventions, patient ed, we'll see them called different things in different textbooks. And then students are confused. So if we can kind of help point them in a direction, let's see where terms are really synonymous. And then that kind of takes away some of that confusion. So in assessment, these are some of the other terms you'll hear and see in textbooks. Sometimes assessments are going to be called clinical findings or clinical manifestations or signs and symptoms, right? And those are all pointing us back to that we're gathering assessment data, right? It's back to the physical assessment, the patient history, review of records. Those things all come back to the assessment. So if we're looking at test questions and we see words like I'm showing here on this slide, words like observe, verify, check, inspect, those are all kind of pointing us back to that we're going to be being asked about something to do with our patient assessment. Does that make sense? Have you seen those kind of words a lot in text? Yeah. So the next one, okay, in our implementation, our interventions, again, synonymous terms, and you will see this, the big place I've seen it a lot that's hard to pick up on, but once you see it, it's a great pattern. In the Saunders Comprehensive Review, you know, the Saunders textbook, Comprehensive Review for NCLEX RN, it uses some of these synonymous terms. So in interventions, we'll see a lot about nursing care, right? We'll see nursing care. We'll see things like nursing actions, patient care. You know, in a test question, we might see, you know, assist, instruct, administer, perform. Those are all kind of clues that now we're going to have to pull something out of our category of nursing implementation or nursing interventions. Delegate, that's another one. Document, those are all actions that we're taking. So you kind of have to look for those action kinds of words that point to we're doing something that's an implementation. And then in patient education, you know, sometimes it's easy to spot, but sometimes, depending again on the text, you'll hear client education, anticipatory guidance, tools for self-management, right? These are all pointing us to the direction that these are clues that it's about important key content that we're going to be teaching patients. So I like to break down that patient education into like primary patient education, health promotion. That's all things that are just important for healthy living, right? So it's all things with diet, with exercise, with all the activities of daily living, right? Dressing, hygiene, all those vaccinations. So we have a whole wheelhouse of health promotion things that we teach. But then what if we understand what those things are, the easy parts that we can add in are more of these tertiary special pieces. So we're adding in special and unique education based on the specific topic that we're covering. You know, for example, like when I say these tertiary patient education, think about how much crossover there is if we're talking about care of a neutropenic patient, you know, patient undergoing cancer therapy or has some type of blood dysuria, right? And the immune compromised patient. So in both of those areas, we're looking at safe and protective environments, right? Hand hygiene, contact with people with illness. So you have to learn special pieces to fit in that are parts of that education that applies where it falls in that tertiary framework. And another one, for example, is like patients at risk of bleeding, right? Thrombocytopenia. Also someone on anticoagulants, say heparin, warfarin, all things there that we would have to fit in that tertiary framework is bleeding risk, right? Head injury, bruising, not taking NSAIDs in combination with those kind of things. So you kind of see how you can learn those in kind of a grouping. In NCLEX, there are 4 client needs categories. You know, they always tend to call it client. So their client need categories are safe and effective care environment, physiological integrity, So the care we're rendering, the person's health, their physiological care integrity, psychosocial integrity, and the last one is health promotion and maintenance. So this is a big, education is a big it's a big category on NCLEX. So don't forget about learning those kind of pieces. So I've always felt like if students understand how this fits together, then they can start before they even get to class. You know, when you're doing your own reading, if they're looking for these categories of information, when they're reading information before they come to class or they're doing an assignment, when they come to lecture and we're listening or note taking or doing a classroom activity, that's another place to sort of reinforce that. And then doing kind of a post-lecture review or post-activity review, looking for and solidifying those concepts. Now, you know, you guys have been at this for a while, so you see how that fits together. But it really takes a lot of repetition for most people, unless somebody has a photographic memory. I don't. It takes a lot of repetition. So I use one of these things with students, and it helps me myself, is called spaced practice. And that means the more times we come back to familiar material, it really becomes part of our working memory. So I generally suggest that students are prepping before they go to a lecture, and then they take a little break after and review that material the same day. There's learning science that has shown that if you review material at 1 day, 1 week, 1 month, that it really becomes entrenched in our memory. And we're not here to try and memorize stuff. Everybody knows there's way too much information, critical content to memorize. You really just can't go through nursing school memorizing. So if you kind of get the gist of these, this kind of learning takes you forward, you know, to pass NCLEX, but it also takes you forward for patient care, basically. This slide is just an example. This came from Silvestri, also has another study skills test taking book. I just wanted to point out where it's talking about in reading, where it says highlight key points. And it says key points include any information in the text that has to do with nursing care of the client. Okay. What did we just say a few minutes ago? Nursing care was also synonymous with implementation and interventions, right? So this just shows you this is why people get confused. And then it goes on to say key points would include signs and symptoms of a disorder and nursing interventions. And what did we say signs and symptoms pointed to?
Assessment.
That was the assessment, right? That was the assessment category. So I just wanted to show you that this is what happens. But if we can nail down that kind of content, it's really helpful for students. It might be helpful for you too, as you're studying yourself. I don't know how many people have tutored. I can only see 2 of you online there. I think did you guys both tutor last semester?
Yep.
Yes.
Okay. Okay. So you kind of
I
understand.
tutored last semester as well. I'm sorry.
Yes. Yes. Okay. Thank you, Brittany. You know that in tutoring, you are not required to reteach big blocks of material. And you do not have to be the content expert on everything nursing, right? To be effective at tutoring. So it's really good to talk about some of the things that tutoring is not, and that's really not the purpose of tutoring. The other thing that you probably experienced if you've all tutored, you know, we're not therapists. There'll always be on occasion, I like to think it's the minority of times, but sometimes students will come into tutoring and they want to talk about how they don't like an instructor, or they want to complain and argue about a test question or something along that lines, right? And so I think it's fair to give people a little bit of time, but it's also perfectly appropriate to try and cut that off, because if you head into a direction that's really not within our scope of tutoring, I mean, you can spend an hour at that. So I don't know if you've experienced that. Or the other one is people will say, well, what's on the test, right? And that again is really not what tutoring is about. Tutoring is about helping students become self-sufficient and knowing what is important information. So I think it's very fair if you find yourself in one of those situations to say, I hear that you're frustrated, but here is what I can help you with. That's kind of like therapeutic communication. I hear that that's a struggle. Here's how I can help you, is sometimes a smooth transition into moving on and not spending, a long period of time on something that is not really part of what tutoring or academic coaching is. So these are just some ideas. Really, what is tutoring or academic coaching? Helping people with time management, organization, finding ways for them or giving them suggestions about what works for their learning style. The key content, things like we already discussed, goal setting, practicing test questions. A lot of times students really benefit from finding resources with test questions. And I know that you all have that Nursing Central, which I got into that last semester. I thought it was great. So if you can point people in there to textbook resources, Saunders, the Silvestri text, the Davis Drug Guide, and their textbook resources almost always have NCLEX style questions. So if you can encourage them, or even for yourself, the more of those you do, the more you're familiar with that style. And you can't memorize a whole bunch of test questions, but what you can do is understand the rationale for how you choose the best answer for those, whether it's select all or a single answer question, or, now with the new form of questions where we're building kind of a case study, how do we, more practice with those questions can be really helpful. And referring people to counseling center or having a learning evaluation, whatever. And you're in a prime spot to refer people on for things that are outside of our scope. And just remember, there is sort of privacy and confidentiality things to consider, just like there is with patient care. I mean, we hear things in tutoring that people wouldn't want shared. And so, that should be considered confidential. And academic integrity, don't ever put yourself in jeopardy by helping someone with work that you've done in the past, because the way these systems work, projects are turned in, all of our work that gets turned in can be looked back at. And I have seen people help students with some of their assignments by sharing their own work. And then that puts the tutor in kind of a compromised position as far as academic integrity. So, we're trying to help people be self-sufficient in learning. And you don't, just consider what works for you and what keeps you intact academically. I like to give people other resources. There are a dime a dozen on the YouTube channels. Some are better than others. So what you've liked. I happen to like things like Nurse Sarah because she does this same kind of framework. Saunders, like I said, but some of the stuff online, some of the nurse entrepreneurs, they want you to buy study guides, or, or like Khan Academy can take you down a really long black hole of pathophys. So some of those sources are just better than others. Kaplan, I think I've said before, here's some Nurse Sarah, registerednursern.com. Kaplan has some good resources on YouTube. And this learningscientist.org, they have downloadable resources for different learning styles. So, and the science of learning. So some of those can be good for students. And of course, as many videos that you can see or exposure to NCLEX style questions, I think those are all worthwhile to help people with. So we just went through that pretty fast. And we have a few minutes, so I just wanted to open it up and see if you have any questions, comments, anything you'd like to clarify on, or if you've had your own experience with something you want to share about this, we've got time for that.
When it comes to students, a lot of times I've been working with the sophomores a lot, and it can be a very nerve-wracking semester for them. It's
Yes.
everything for the first time. And it seems so far that the main thing interfering with them is their anxiety regarding like content and all that, just so much at once. How do you recommend trying to coach them through that?
Well, at what point have you taken some of your own like psych mental health? Have you hit, I'm not sure what your curricula for,
We've covered psych.
Okay. So, all of those same things that we're taught to work with patients that are feeling anxiety, that like the focused breathing, mindfulness, those kind of things are always good for suggestions. I generally have told people that the more you master material, the less reason you have for anxiety, because all of us get into a test situation and our anxiety level goes up. So, if you're very familiar with the material, the chances are you have less anxiety about it. If you kind of know things from the perspective we're talking about. So some of that is just mind-body suggestions. Some of it's content, how they study. But again, some people really do have anxiety type disorders. And for that, they need to seek, they need medical advice, or they need they need an evaluation so that they can maybe have accommodations of testing alone or that kind of thing. So does that help answer?
Yes, it does.
Okay.
You mentioned study guides and making their own study guides as being a really big gain. I've struggled with this in the past because I think making your own study guide is really powerful if you can figure out how to do it to a point where it would be an effective study guide. Do you have like a method that you like to teach for doing study guides?
So I used doing a study guide myself, and that was pretty much off of that framework of assessments, interventions, patient ed. Okay, I did that. Was how I made a study guide. Now, I see a real strength here at CSU Pueblo Nursing, which is, don't they give you objectives? Do you have objectives? Okay.
You would make that study guide to the formatting and the objectives?
Yes. If you can answer the objectives that have been listed, if you can really have that information processed enough that you can see and answer questions about how the information fits together with the objectives, how it fits together with the nursing process, that's your study guide.
Hey, thank you. That's fantastic.
Because all those objectives from lecture, from the course objectives from, you know, each year as it goes forth, that's what you get tested on. You know,
Yeah.
so the
I think
piece
just
of
getting
nursing
to the point where
process,
students aren't
but
scared to say,
the objectives, if you marry those together, you've built your own study guide right there.
thank you.
Brittany, do you have any questions, comments, anything you want to contribute?
No, I don't have any questions or anything. Thank you.
Okay. Okay, well, thanks so much for your time today. I hope that, you know, you can leave with one or two things that might help you when working with students, or something that might help you with your own studies. And tutoring is great in that it really solidifies your own learning process. I mean, I always learn more when I teach something. I know it that much better. So it's really a great way to nail these things down and be successful yourselves over the long haul. So, okay. Thank you. I really appreciate your time. Have a good rest of the day. Bye.
Thank you so much.
You're welcome. Bye.
Bye.
It's quite that Dr. Cooke doll.
Oh, thanks.
Yeah, you might be able to just shut off that record button. Did you do that? Thanks.
Oh, that's nice.
Okay, have a
Classes
good
are fun.
bye.